there's an initiative called Reimagine Childcare. It's a follow-up to a long-term series we've been doing called Right from the Start NJ. It's all about childcare, particularly in this pandemic. Childcare, quality, affordable childcare, more important than ever?
It is really one of those pivotal issues that affects so much of our well-being as a country, from our economic well-being to our children's success and well-being. And we are such an outlier on the planet's industrial nations that we do not have high-quality, affordable childcare for all.
What exactly is the commitment to childcare from your administration, and who will it help the most?
Yeah, I mean, $250 million of federal CARES Act money to childcare. We can't find another state in the nation that's put that much to work. And so the 250 breaks down into a bunch of buckets, Steve, but the big ones are money to get daycare centers back open and on their feet, money to subsidize their operations because we're limiting capacity. And then the biggest chunk is money to families under a certain income level who otherwise could not afford childcare.
In these tight times and with this pandemic, with so many parents trying to figure out how to work with their kids, remote, hybrid, all kinds of things going on, how high a priority is quality childcare?
Well, it's extremely high. And you know, in recognition of the governor, he put $150 million into a program to help people afford childcare. You know, Steve, we're really in a catch-22. You know, we need our schools. We need our kids to go back to schools. The kids need to be with kids. It's not safe right now, so they're home. People have to go to work. How do you go to work if you got to watch your kids and teach your kids? So having affordable childcare is critically important to get us through this pandemic that we're dealing with.
Providing affordable and accessible childcare, again, exacerbated even more so because of COVID. But again, worse, it's an even more serious problem for women who are Black and brown, correct?
That's correct. I mean, it's logical if you think about it. Childcare in its best of scenarios is inaccessible and unaffordable. If you, and for people who don't have money, people who don't have access to transportation, don't have access to their doctors, having a child at home is going to only make that scenario even worse. So there's absolutely no question. I know that the administration has been working on this, and I give Phil and DHS a lot of credit for the incredibly innovative ideas that they have been coming up with to try and fix this, and they will continue to do so. I also will tell you that it's something we're looking at through the New Jersey Pandemic Relief Fund as well. So you know, there's a lot of good people working on this right now.
If more child care centers close because of the economics, I mean, quality child care centers, what are the potential implications longer term for those children, their futures, and their families?
So we're the workforce behind the workforce, right? In order for parents to go to work,
that's right,
childcare, right? So the future, you're going to probably have a lot more parents, whether they're moms or dads, coming out of the job market because they won't be able to find affordable, high-quality childcare. You'll have maybe unlicensed centers that are opening to try to help parents. And unfortunately, once a center is unlicensed, then we know that there are some things that can happen that could put children in jeopardy.
Right.
I think you'll also see an increase in the access and equality, right? Like there will be a huge divide between the haves and the have-nots.
When it comes to childcare, how much more important is it today, quality and affordable childcare, accessible childcare, particularly in the age of COVID?
Steve, what you're talking about is something that has been important and will continue to be important. I am absolutely a proponent of quality. I want to make sure that folks understand that during this time of COVID, this is an interesting time. Up until now, the saying was, nothing's impossible. And then I hear this thing that says, things are only impossible until somebody does them. And in the time of COVID, we've learned that we can do a lot of things that we thought we couldn't do, that we thought were impossible. Having quality at all of its levels is something that we can do and we need to do for all of our children.
COVID-19 has impacted the child care crisis, if you will. How?
So we are looking at an estimated 1/3 to 1/2 of childcare providers not being able to stay open due to the need to shutter their doors when New Jersey was impacted so hard at the beginning of the pandemic. And even now, as they're looking to reopen, in order to keep their space safe for these children, they need to have lower ratios of staff to children. That means less revenue for them because fewer families are able to attend their childcare centers.
Evan, there's been extensive research that has been done and talking about the economic implications, the social emotional implications of not having quality, affordable childcare. What does the most recent data tell us?
So the most recent data, the most recent research shows us that childcare is one, critical for early education for kids. If you're talking about kindergarten readiness, you're talking about socio-emotional learning to get along with others, it's critical there. But I think something that's top of mind for everyone nowadays is its impact on the workforce. It's the ability for parents to go back to work. It's the ability for them to go back and get further education. It's the ability for them to focus in on their work. And this is something really important for the emergency responders, for the heroes during the COVID crisis, for them to focus on their work and know that their kids are safe elsewhere.